Hey guys, I'm Bailey Cadell, and I did my research project on nursing care for amyotrophic lateral sclerosis, also known as ALS or Lou Gehrig's disease. ALS is a fatal and debilitating disease. Nursing care requires a great amount of flexibility and individuality. The disease varies from patient to patient depending on their symptoms, prognosis, and rate of decline. Since there's no cure for ALS, nursing care will focus on preventing complications, protecting the patient's quality of life, education, and staying in high communication with the patient, family members, and other members of the healthcare team. What is ALS? ALS is a neurological disorder characterized by loss of motor neurons. A motor neuron is a nerve cell located in the brain and spinal cord that connect to muscles and control voluntary movement. What occurs in ALS is motor neurons in the brain stem and spinal cord gradually degenerate. These dead motor neurons can no longer transmit signals to muscles. This results in the loss of voluntary movement and muscle atrophy. There are many different implications for nursing. Preventing complications, education, protecting the patient's quality of life, and communication all fall under this category. Preventing complications of this disease process includes a wide variety of interventions for the nurse. Some of these complications include risk of aspiration, respiratory insufficiency, maintaining adequate nutrition, maintaining muscle strength, and prevention of falls and depression. Monitoring secretions, dysphagia, removing safety hazards, talking to the patient about insertion of a PEG tube, and pairing up with physical therapy to do as much exercise as possible can help with all these complications. With education, this requires educating not only the patient but the caregiver about ALS. The progression, the patient's current state, end-of-life care, interventions that need to be made, and treatment options are all involved in this. Improving the patient's quality of life involves individualized care and communication with the specialist so the patients with ALS get the care that they need. Allowing the patient to make decisions and being independent as possible gives a sense of hope and dignity, which can also improve the patient's quality of life. The most important aspect of nursing care with a patient with ALS is staying in great communication with the patient, family, and other members of the care team. Communication with members of the team include physical and psychosocial care. For a patient with a fatal and debilitating disease is a serious and challenging aspect of nursing. There are many ways, however, to improve the quality of life of the patient with ALS. Being in collaboration with the patient, the family members, and a multidisciplinary team improves the care provided. Education also comes hand in hand with being a nurse. As a nurse, it is important to remember to not only educate others, but also educate oneself on the many aspects of the disease suffered by the patient, the many needs of the patient, and the treatment options available. There are many different things that I've learned after doing this research project. Some of them include being educated on the patient's condition, medications, and treatment options, how vital it is to stay in high communication with all participants of care, finding answers to any of the patient's questions along with any questions that the family members have as well, staying updated on new technology and where to find information if I need it, and finally, how to improve the patient's quality of life to the best of my ability.